The ZoptEC trial was a randomized phase 3 trial of a new agent, Zoptarelin, compared to a traditional treatment, doxarubicin, for advanced recurrent endometrial cancer in patients who had previously failed platinum and taxane chemotherapy. Zoptarelin is a very interesting drug because it is a conjugate of doxarubicin bound to an LHRH molecule that binds to LHRH receptors, which are found in many reproductive cancers, not so much in normal tissue, but particularly in endometrial cancer. About 80% of endometrial cancers express this receptor. So this drug was developed. Phase 2 trials had suggested activity for Zoptarelin in advanced recurrent endometrial cancer. And so the company was interested in getting this drug registered for endometrial cancer, because as you may be aware, we only have 2 drugs that have been approved for endometrial cancer, and so there's a significant clinical need for approved therapies. So we launched this randomized trial of the Zoptarelin versus regular doxarubicin in the advanced recurrent endometrial cancer population. Unfortunately, Zoptarelin was no better than doxarubicin. The response rate for the Zoptarelin was 12%, it was 14% for the doxarubicin. The progression-free survival for both drugs was 5 months. The overall survival for both drugs was 11 months with no significant difference. The toxicities were mainly hematologic, but again, no significant difference in terms of hematologic toxicity or even cardiac toxicity, which is one thing that we had hoped to significantly reduce. So the important message for this study is, one, it shows that even if you have a very exciting targeted therapy, you need to do the heavy lifting, the randomized phase 3 trial, to make sure that what you think is an advance is actually going to help patients. And unfortunately, it did not.
Are there any plans to see what could be done to understand why the addition of the LHRH didn't improve outcomes, or go back and try a different conjugate?
Well, it's a very small company, and they unfortunately don't have the means to further develop this drug. So it's my understanding that no further development will occur.
Negative results are still results.
They're important because, for example, doxarubicin remains the standard of care, second-line cytotoxic chemotherapy for endometrial cancer, and it probably is the bar that some new agent is going to have to exceed.
Until that day comes, I think that's all there is to say for Zoptarelin then.
Unfortunately.